Or shot fire, officer down, shot fire, officer down. Got a city officer down, shot fire.
223, be advised, we have a visual on enemy paratroopers in grid Papa uniforms.
Welcome to the Resilient Warrior Nation, a podcast dedicated to inspiring hope and healing for first responders, military veterans, and anyone facing PTSD and trauma. Hey guys, welcome to another podcast episode of the Resilient Warrior Nation. I'm your host, Mike Morgan. First of all, I'd like to tell everyone why I created this podcast. The shirt I'm wearing is not a proclamation. This is actually the company of a man named Eddie Penny. Eddie is a former Navy SEAL Team 6 guy, and he was a guest on the Sean Ryan podcast in the spring of 2023 when I sat down and watched, not knowing that episode was going to change the entire trajectory of my life. During that course of the episode, Eddie was recounting the story of the Extortion 17 incident in which a Chinook was shot down in Afghanistan, killing all 38 souls aboard, including 17 SEALs. It was their largest loss of community in one event ever. Included in the dead was Jason Workman, Eddie's best friend, and Eddie was recounting the story of escorting his best friend's body back to his hometown. As he did, he was upset, rightly so, and I simultaneously began thinking about a call that I had had 5 years before. I am a medically retired 30-year police officer veteran, and that call was a 2-year-old found floating in a pool. So as I thought of that call and watched Eddie cry, I now know I subconsciously was given permission to cry also, and I literally began crying like a baby. Wasn't sure what was going on, but very shortly thereafter, I realized that the feelings I had been experiencing for about the past year and a half prior to that were some sort of PTS that I'd suffered in my career. I was always under the mistaken impression that PTS was only suffered by seeing your brother or sister next to you get killed. Mine was suffered by being inside the most devastatingly intimate moments of other people's lives over and over and over and over. And at that point, I realized I needed help. I was not going to be this ornery man who hated everyone and everything for the rest of my life, as we see many people who do. And I began thinking of available treatment options. I didn't think that traditional counseling was going to do it for me. I didn't think I'd be able to talk to a man or woman sitting behind a desk who's never seen or done the things I've seen or done, and they'd be able to help me. So at that point, I began focusing on psychedelic therapies that I had also heard these special force operators speak about on the various podcasts that I'd watched. I decided that ayahuasca was calling me, and I journeyed with ayahuasca last March 1st of 2024. The experience changed my life during the course of 4 hours. The whole retreat lasted 3 ceremonies over the course of a weekend. And as I was coming out of my first journey, the universe and I were speaking. I know it sounds weird if you never experienced this yourself, but the universe told me it had healed me from my PTS, and my life's mission was to go forth and help other vets and first responders heal theirs. So I literally said, okay, out loud. Wasn't sure how it was going to be implemented, but I decided to, number one, start a podcast to do for others what Sean Ryan did for me. And in that vein, I bring on ordinary people who've done extraordinary things with their lives, and we discuss their highest of highs, the lowest of lows. I bring on professionals, as I have today, and the professionals talk about various issues that we face as first responders, vets, and everyday citizens. So in that vein, I'd like to introduce my next guest. I'm super pumped to introduce Dr. Leah Kaylor. She is a licensed clinical and prescribing psychologist who has served as the FBI sleep expert for over 5 years. With a passion for optimizing human performance, she's on a mission to help others harness the transformative power of rest, because better sleep shouldn't be top secret. Dr. Leah shares practical, science-backed strategies on her YouTube channel, and her upcoming book, If Sleep Were a Drug, hits shelves on October 1st, 2025. If you can't remember the last time you had a good night's rest, head over to her YouTube channel. Dr. Kaylor will show you how to take your sleep and your performance to the next level. Each week, she breaks down the science of sleep into practical, easy-to-use strategies to help you sleep better, recover faster, and enhance your quality of life. Dr. Leah, I welcome you to the Resilient Warrior Nation podcast. It's an honor to have you on.
Thanks. I'm excited to be here.
Thank you very much. I don't hear that often. Yeah, exactly. I'm excited. Let's talk sleep, baby.
It's my favorite thing to do. It's my favorite thing to talk about. I'm in love with sleep. Yes.
That's great. Yeah, it'd be kind of weird if the sleep expert slept 2 hours a day and that's all she needed. Which I
that
wish.
Would be super problematic. But B, I haven't always been the greatest sleeper. I haven't. So it was also a journey for me too. Yeah.
And how did it start for you, this journey into sleep science?
So let's go way back, and I'll tell you about my issues with sleep, and then I'll talk about my journey into sleep. So
absolutely.
I was a collegiate gymnast, and I am also very much an early bird, so I would pick the earliest morning classes, like all the 8 o'clocks that the college would offer. I would go to class, I'd go to the library, go to lunch, and then I thought it would be a great idea to go take a nap, and not just a regular nap, but several hours long nap, 2-3 hours in the afternoon.
Whoa.
Then I would get up, go to gymnastics practice, which normally those are very long. They're normally 4-ish hours.
What? 4-hour practices?
Oh
my
yes,
God.
Sir. We're very serious athletes.
Oh, I know you are. My ex-wife was national level, and to hear the training, she used to go to school half of the day.
Yep.
And then Bella Caroli was a coach for a little while. And she was not a fan of Bella Caroli, though. She was not a fan of his, but he was a hard-driven man, a hard-driving man, I should say. But you guys, the strength that you gymnasts possess is second to none. It's unbelievable. I love watching you guys do your thing. It's incredible to me.
It's an incredible sport, not to sidebar us, but people forget about it until the Olympics. Every 4 years, then people are like, oh my God, that's so amazing. And then it dies down. But yes, it is an incredible sport, the strength, the flexibility, the endurance. I mean, you name it, it's incredible. So yes, our practices are not, they're typically 4 hours long. And just like your wife, I used to go to half day at school too. The training is no joke. That's why I was so sleepy and taking insanely long naps in the middle of the day, because my body was working so hard. So yes, I would take these naps, I would go to long practices, and we were also expected to go lift weights in the gym too. Then I would go to dinner, maybe I'd go to the library and study some more, and then it would be what I thought was my bedtime, and I wasn't sleepy, and I couldn't figure out why.
What time was this approximately?
I like to go to bed around 9, 10. So I'm thinking, what's the deal? Why am I not tired? What's going on? I woke up early, I worked my body hard, I worked my mind hard. What's going on? What do I need? Do I need sleep aids? What do I need? And I couldn't figure it out. And this went on for quite a long time. And so as I'm describing this is my undergraduate years. So I just can't figure out what my problem is. Hindsight is always 20/20. Right now Leah could talk to past Leah, she'd be like, well, here's all the things you're doing wrong. But so fast forward, I'm in my PhD, I'm in my final year of my doctorate at St. Louis University, and we do something, all PhDs do something called a match. And what that is that it is your final year to be as well-rounded as you possibly can before they send you out into the world for you to work under your own license. And in the scenario where you go on your match, they want to give you as many experiences, as many rotations, as new and different and interesting cases, things you've never done before, so that you're just super, super well-rounded and ready to hit the ground running. And so I end up matching at the Memphis VA Medical Center, and you have several rotations all year long. And so there were 2 that I really had my heart set on. And everything else I was willing to be flexible, which you have to be, because what happens is we take all of our interns, we take all of our postdocs, we all come together in a room, and nobody leaves until everyone has rotations and is relatively happy. So there has to be some compromise. And unfortunately, I cannot remember if the sleep rotation was one that I really wanted or if it was one that I just compromised on. But as I look back, I couldn't be more grateful to have been put on the sleep rotation and to have had that experience. And while I'm there, again, my sleep problems were mild. I just kind of wondered, what's the deal? What's wrong with me? Why am I not sleepy? But as I'm at the VA and, I'm working with people who are active duty, I'm working with veterans, I'm working with, I don't know what the deal was, but I had a lot of Vietnam veterans on my caseload. So I just had a really wide range of people who were struggling, and whether that was general sleep hygiene, whether that was sleep avoidance, just being so scared to go to sleep, nightmares, struggling with obstructive sleep apnea and being afraid to wear their CPAP machine. I mean, you name it, I came across it. And again, I just felt so grateful to be able to sleep now that I was seeing these folks who were struggling night after night after night, and got a chance to learn all of these incredible skills like cognitive behavioral therapy for insomnia and imagery rehearsal therapy for nightmares. So getting tons of tools for my clinical tool belt to be able to help people. And it was really wonderful to watch as I'm seeing these people coming in. And I mean, one individual that I'll never forget was sleeping, and I don't understand how he was continuing to function, but like 1 to 2 hours a night. Like, wow. I don't understand how you're continuing to function, sir.
Yeah.
And this is something that I will say time and time again, is good sleep does not happen overnight. And we worked together for months, and by the time that our sessions were through, he was sleeping an entire night. So it is possible to get to a better place, but it absolutely takes time. And so I think that that's so important for people to know if they're struggling and they're listening, or, you know, if they're going to read a book or they're going to listen to a podcast or whatever it is that they're going to do. Just know that good sleep doesn't happen overnight, especially if you're someone who's been struggling for weeks, for months, for years, for decades. It takes time to make changes, for the brain to rewire itself. So don't be hard on yourself is my main message. And then, you know, I finished with the Memphis VA Medical Center, and my first real job, if you will, is I get picked up with the FBI as a psychologist. And in my first weeks there, my supervisor asked me, okay, Leah, so what's going to be your thing? And I said, well, I don't know. I just got off a rotation at the sleep clinic. You know, how about that? Because everybody can relate to having a crappy night's sleep, whether it's your pet waking you up in the middle of the night, chronic pain.
My dog did it 5 times last night. It's so funny you just mentioned that.
Mm-hmm. Yep. Everybody can relate. And it doesn't have to, it absolutely can have to do with mental health issues, but it can also be for lots and lots of other different things. And so in my mind, I was thinking, well, this is going to be like a little bit of a tricky, like, I'm going to get my foot in the door while we talk about sleep issues, but I know that chances are there's probably something more underlying that. And so that's how it all started. And my very first presentation within the Bureau was on sleep, and it just grew and snowballed into much more than I was expecting, because my other specialty is trauma, and I really thought that that would be what was used more frequently. And I would say they go hand in hand, honestly. They really do. And so there's just been such an appetite for sleep education, for one-on-one sleep help, for nightmare work. So it's been a wild ride these past now 6 years. And I like to say that the Bureau keeps me in the highest room in the tallest tower and really likes to keep me to themselves. But it was just this past year that I got out into the community more and have been working more with state and local and first responders and military. And I went to a conference in October, and this was all just wellness, resilience, how do we get to a better place? And so when I'm at the Bureau, normally our conferences are on the smaller side. Like, we have one room, we have a list of presenters, and so you're kind of a captive audience, whether you want to hear about sleep or not. Right. Or if you fall asleep on me, I'm so used to that. It is what it is. But
mission accomplished.
Yeah, I mean, yes, that is also mission accomplished. You're right. But at this particular conference, I'm a breakout session, so you have the choice to come see me versus all the other exciting things that are also going on. And I was just blown away by, they gave me one of the biggest rooms. It was completely full. We didn't have enough seats. We had to bring more seats, standing room only. I was blown away, not just by that, but how interactive the audience was, how interested they were. I mean, there was just so much interaction. And as the session came to an end and, you know, people were saying thank you and goodbye, this woman came up to me and said, you know, this was fabulous, but the person who really needs this, my best friend, she's not here. And so do you have a podcast? Do you have a handout? Do you have a book? And I'm like, excuse me? You would read a book? And this woman planted this seed, and, you know, I traveled back home after doing that conference, and I said, you know what? Let's do this thing. Let's write a book. Nice. And so it comes out on October 1st, 2025, and it's called If Sleep Were a Drug.
Good for you. I love it. I mean, there's a need for it. There's no ifs, ands, or buts about it. As you can see with all the people that are entering that room when you were doing the breakouts. Yes. It's amazing. Now, as you're going through life in the FBI and you're dealing with this with these sleep issues, is there one that trumps all the others, or just collective different reasons?
You know,
that's as to why people can't sleep.
That's a really good question. And I would say that I get tons and tons of referrals because we have mental health professionals all across the Bureau, but I have made this name for myself as this sleep guru. And so everyone knows, hey, if you're having sleep issues, you got to call Dr. Leah. So I get tons of referrals. Hey, you know, this client is having sleep issues. Do you have opening on your caseload? I'm like, yeah, of course, send them over. So I work with tons of people. And at first, on the surface, it looks like a sleep issue. And this is particularly, I would say, more so when I'm talking about my agents, my joint task force officers, you know, my first responders, military. 9 times out of 10, it's a sleep issue, but the underlying issue is untreated stress, anxiety, depression, trauma. That's usually what it is. And yes, absolutely, you are having trouble sleeping, but it's because they go hand in hand. They are this vicious cycle, and there's a lot of vicious cycles when it comes to sleep, where if your mental health isn't good, chances are you're probably not sleeping very well. If you're not sleeping very well, you're not going through those restorative stages, you're not getting this emotional recalibration that you should be, and so then your mental health challenges continue. So it's this cycle. So I would say that's probably the number one sleep challenge that I'm seeing, is just underlying untreated mental health concerns that are then just fueling sleep as a symptom.
Okay.
That's what
so
I
essentially,
say.
Once that is, I don't want to say healed, but dealt with, their underlying mental issue, the sleep kind of takes care of itself?
I think so, but also I hit it from both ends. So I treat the trauma, and then I also give tons and tons of sleep tips and tricks and strategies, because we do a lot of things to get in our own way. Even if you are not really having any mental health challenges, but you are having trouble with sleep, there's always things that you can learn and you can do better, in my opinion. And one of the things that I love to say is, you don't know what you don't know. And, you know, I think that it comes to like the timing of exercise, caffeine, alcohol, meals. Like, I think that there's so many things about sleep that it's just kind of like this very mysterious thing that if you knew so much more, if you knew all the things that I knew, that you could absolutely be improving your sleep. And so I think that I like to hit it from both ends, in that I like to treat the trauma, but I also like to give you tools where you can be improving your sleep just by doing simple little things here and there. So I like to do both.
And what might they include, those simple little things?
Yeah, so one of the biggest things that I always do with people, and in fact, I won't see anyone for sleep issues until I see about 2 to 3 weeks worth of sleep data. And so what that looks like is, I'm very old school. This is the way I did it at the VA, and this is still the way that I do it to this day, is I have a sleep log, and I teach people how to track their sleep, because wearables are fantastic. You know, I'm wearing 3 right now, and I also have a smart bed. It is what it is. But I think there's something very unique about using paper and pencil to track your sleep. And what I want to know is, what time did you get into bed? What time did you try and fall asleep? And just right there, just those top 2 questions that are the top 2 on the sleep log tell me a lot. And this is, again, a piece of like, you don't know what you don't know. When I go and do sleep lectures, and this is always something really funny, I will have like a whiteboard with me. And I'll ask people, and I started this at the VA, of what is it that you're doing in bed? And I'll put bed in the middle, and I will kind of draw a circle around it. And I'll ask people, what are you doing in bed? And people kind of like get this like weird giggly, like, you know, what is she asking about?
Exactly.
And then normally people will say, well, watching TV, scrolling on my phone, talking to my partner, reading, journaling, doing homework, paying bills online. And so I start to draw lines going from bed out to all these different things. And, you know, people tell me all kinds of different things. And then I ask them, okay, so how strong is the association between bed and sleep? Because ironically, a lot of people, when I ask, what are you doing in bed, forget to say sleep.
Yeah.
Ironically enough, you know, they tell me all the other things that they're doing. And so I ask, how strong is this association between bed and sleep if you're also paying your bills and doing this and scrolling and watching funny cat videos? Like, and then people, once you see it on the whiteboard, you're like, oh, yeah, maybe not that strong. And so just right there, I tell people about what we call the 3 S's, which are sleep, sex, and sickness. Those are the 3 things that you should be doing in your bed. So sleep, you should be doing that every night. Sex, I don't know how often you're doing that. Good for you. That can absolutely be done in the bedroom. And then last but not least, sickness. Whenever your body's trying to fight something, when you're trying to recover, all bets are off. Listen to your body and sleep. But otherwise, those are the 3 things that you need to be doing in bed. So everything else, here's the thing. The brain is brilliant but it's also kind of dumb sometimes. And so if we're doing all these other things in bed that we shouldn't be, when the brain gets into bed, it's like, wow, I have so many options. I can engage in entertainment. I can work. I can stress. I can sleep. Like, I have this menu of options. What should I do? But if we take all those things out of the bedroom and we get into bed and we do that night after night after night and we start to create this association and this habit, then the brain is like, oh, well, I only have a couple options here. And I know that I only have one definite option, which is sleep. And so that right there is one way that, you know, you don't know what you don't know. And that's often a revelation for people that, oh, I shouldn't be doing all these things in bed. And there will be some people. I lived this life at one point in time. I shared a studio in New York City. Woof. But at that point in time,
about
like
10 square feet of space.
Yes. But my bed was my bed. It was my desk. It was my couch. It was my hangout area. And so I get it. There are some people that don't have the luxury of that, and that's another different conversation. But I would have people who are grown adults who do have a whole entire house, and they tell me, yeah, I just hang out in my bed for hours. How confusing is that to the brain? So it's just simple things like that I teach people that once you, and I believe that knowledge is power, and I believe once you know something, you can't unknow it. And so I think that, you know, if you want to change things, if you want to start sleeping better, that right there is very simple and easy. I'm not telling you can't do all these things. I'm telling you, go to your living room, go to your den, go somewhere else and do these activities. And then when you feel sleepy, go into your bed.
Yeah, it makes sense. I remember reading an article, it was probably like 30, 35 years ago, about essentially exactly what you're saying. And I always thought the bed is a sacred place from that point on. So
yes.
When I'm ready to go to sleep, I go into bed. And then only because my wife likes watching TV, so now I'll watch maybe 30 minutes of TV. But there's never, first of all, we have like a rule after 8 o'clock, like social media is done.
Great.
We're talking or watching TV together, like that's it. So there's no scrolling ever in the bed.
Good.
You know, sex and sleep, and that's it. I've had a problem the past few years where I really can't sleep that well. Like, I fall asleep fine, but an hour and a half later, I'm wide awake. So I've taken to using an edible to sleep, and I sleep solidly, but I don't like, I don't know, in my mind, I just can't, I don't believe that it doesn't have any sort of detrimental effect. Taking, you know, the cannabis every night, maybe I'm wrong. I do it, but I'd rather come off it, to be honest with you. I'd rather have no substance having to be taken nightly. I mean, but you can't just going off that information. Is there anything you could, like, as far as helpful hints provide, or that's too little info?
No. So one thing I'll say is, because I'm embedded with the FBI, and one disclaimer that I want to make is that everything I say here are my own thoughts, feelings, opinions, beliefs. This podcast is not sponsored by the FBI. Because I'm within the FBI and we have very, very strict rules about everything, you and I talked about this before the podcast even started, is that this is not a road that I've gone down, because there's lots of research out there. There's several other podcasts that you can turn to about sleep and THC and edibles and things like that. But that is not something that I've even spent any time on, to be honest with you, because I know that this is not an option for any of my folks. And so this is just not ever part of the conversation, because I know the rules and regulations, and I have to stick to it too. And so it's not a conversation. However, one thing I will say to you is the best sleep is going to be sleep that's unaltered by alcohol, by prescription medications, by edibles, things like that. So I can at least give you that piece of information.
Right. But any other helpful hints as far as what I could do in place of that? You know, just literally, I'm waking up and, you know, I'm in a gym 5 days a week. You know, I try to get my 8 hours. I eat super clean diet. Like I said, I'm not scrolling. The bed is the bed. And literally, I wake up and I am wide awake. I cannot get back to sleep.
So for this, is it about the same time every night?
Yes. I'll get an hour and a half of sleep and then I'm awake 90 minutes later.
So one thing that's kind of interesting that you could test out and see is that around that time when you keep waking up, set an alarm about 5 or 10 minutes beforehand and just observe your environment and see if there's anything happening, if there's any light, if there's any noises, if there's anything that you notice that may potentially be a trigger that might be waking you up. And it could be something that's very subtle, but I would be very curious about that. If that's the same timing every night, I would do that experiment with you.
I should say the same timing. It's about 90 minutes into sleep, so potentially I'll fall asleep between 11 and 12:30, but it's 90 minutes past that point. So, and I've been awake at that time at night, so there's nothing, no sound going off, no buzzer, no alarm, like no outside interference that would be doing it. Blackout curtains, super cold, bed super comfortable. So it's been. I've always taken sleep serious. I've always gotten great mattresses. It just started probably about 3 or 4 years ago, and I don't know what's causing it.
So this is another thing that I would recommend. So whenever you wake up, you say, I wake up and I can't fall back asleep. And my question to you is, what do you do?
I usually sit there. Sometimes I'll get up, go in the other room, turn the TV on. I never scroll. That's it. I'll either be honest with you, I'll lie there and just try to meditate and just have my mind almost blank, or I'll go in and watch some TV. Those are the two options.
So, again, let me give you some info here, and this definitely ties back to what we already talked about, is the 3 S's. So, one of the other things that people tend to do is when they can't sleep, they lay there. They toss, they turn, they clock watch, they let their anxious mind just kind of loop out and think about all these different things. So that's definitely not helpful. I'm glad that you're doing the meditation. That is definitely a step in the right direction. But what I tell people is that if you know you're not going to be able to fall asleep in the next 15 to 20 minutes, we're not going to continue to lay there, because that's creating an association between the bed and being stressed and being awake and tossing and turning. So what we need to do is we need to break that association. And what that would look like, just like what you mentioned, is getting up, getting out of bed, and going to another room. But here's the ticket for you. When you go to this other room, I want you to do something very boring. And so I would definitely not recommend any screens. You talked about turning the TV on. When I say boring, I mean extremely boring. Adult coloring, folding laundry. Maybe you're doing some light stretching. Something so, I wouldn't even recommend reading a book. That's how boring. Maybe you could, one of the things that I'll say is open up some FBI policy and start to read, and then, that will
there you go.
Put you to sleep.
Insomnia cure.
Totally. But even, I would say not even a book, because if you're someone like me who gets sucked into the story and one more page, one more chapter, we don't want that. We want something that you can easily just turn off and walk away from. So if you have a magazine that you can flip through, something super boring. We do this activity in a dim lit environment until you feel sleepy. And that's when we go back to bed, because then we're teaching the brain, again, we only associate the bed with sleep. Now, one thing I want to say is, it is normal to wake up in the middle of the night. We go through sleep cycles. So we go through light sleep, deep sleep, REM sleep, and then we start it all over again if you're a normal, average, healthy sleeper. And it's not unusual to wake up in the middle of the night. Maybe you use the bathroom, maybe you get an extra pillow, toss and turn and get a little comfortable, and then you should be able to fall back asleep. That is not unusual. If you are someone who's awake in the middle of the night for extended periods of time, that's when it becomes a problem. And so I would highly recommend this particular strategy for you and for anybody who's listening, because I think that when we do this, and we've gotten into a habit of doing this for years, we need to unlearn it, and we need to teach the brain that, no, this is not the time for us to be awake. This is the time for us to be sleeping. So that's what I would say first and foremost. I will admit, this is a highly annoying strategy that I'm giving you. Nobody wants to get out of their cozy, warm bed and go and do something boring like reading junk mail or folding laundry. People don't want to do that. But here's the thing. Consistency is key. So if you only do it some nights and you don't do it other nights, the brain doesn't know. It can't figure it out. You have to stay consistent. So I'd say, if this is an issue for you and you try this for several weeks or months and you're still not seeing a fix, you're not seeing changes, or you're not getting to where you need to be, then there's some other things that we can do. And if you'd like, I can talk about that, or if you have other questions, because like I said, I know I'm verbose and you kind of need to reel me in.
No, not at all. Actually, here's a big one, and this is huge in our community of first responders and vets. I have myself severe sleep apnea.
Yes.
Can you tell? I just had a conversation with someone, and I was trying to relay how detrimental it is not to get tested. In fact, my wife and I had just gone away, and I forgot the cord to my sleep apnea machine for 2 nights.
Yep.
Doc, it was actually happened the first night. I woke up so much with dreams of someone choking me because I kept waking myself up that I did not want. I was almost scared to go back to sleep. Like I was violently waking up, and it was horrible. I cannot imagine having to go through. God forbid we had gone away for a week. It would have been horrible. It was horrendous. So could you just tell these guys how important it is if you suspect you may have this, and how they would suspect that they have sleep apnea? Just talk about the subject. You know what I'm trying to get to with these guys.
Yes, and thank you for bringing this up, because obstructive sleep apnea, so there's also central sleep apnea. We're not going to talk about that one today because that's kind of a whole different beast. We're going to talk about obstructive sleep apnea, OSA. And with obstructive sleep apnea, it is seriously undiagnosed. So there's probably so many people listening to this right now who don't know that they have obstructive sleep apnea. So let me talk a little bit about what it is, and then we'll talk about why it's so undiagnosed. But the rates of being undiagnosed in the general population versus first responders, it is so much higher in first responders. So let me tell you what it is. What happens whenever we sleep, and imagine that I'm like lying down, that the muscles in our throat relax, that our tongue relaxes, and for some people, this relaxation is really super relaxed to the point where the airway starts to close off. So you may have a partial closure of the airway, or you may have a complete closure of the airway. Now, when that airway starts to narrow, that's where you hear the sound of snoring, because the air's still trying to move through. We still need to breathe all night, but the more narrow that airway gets, the louder the snoring gets. Now, there's some things that we can also do to make obstructive sleep apnea worse, like alcohol. Alcohol, sedatives, and muscle relaxers are all going to make the throat even more like loosey-goosey, if you will. Here's the thing. Our brain needs oxygen. It needs a very steady stream of oxygen. This should not be news to you. However, whenever the airway is starting to narrow, or if it closes off altogether, and that's often where we'll hear kind of like choking, gasping, or even your partner might hear like an extended period of silence. This is very concerning because the brain is not getting the oxygen that it needs. So that's when you kind of start to hear this choking, this gasping, because the brain starts to go into like fight or flight panic mode, like, oh my gosh, I'm not getting any oxygen, like, do something, wake up. And so whether you fully wake up or what we call a micro arousal, which is like a brief awakening, either or, it will wake the person enough for them to restart their breathing and open the airway. Now, what I just described to you is one event, if you will. People with obstructive sleep apnea normally have multiple of those per hour, per night. And that's how we know how severe it is. If you go and have a sleep study, typically done, it's called a polysomnography, and you'll go to either a lab, you'll go to a hospital, you'll go to a sleep clinic, and they'll hook you all up. And what they're doing is they're measuring how much blood oxygen you've got going on, how many times the airway partially closes, how many times the airway fully closes. Also, when you go to have a polysomnography, they're also looking for other possible conditions that might be happening as well. But really, whenever we're talking about obstructive sleep apnea, those are like the main key indicators. We need to know how many times per night this is happening and how low your blood oxygen is dropping, and that's how we decide on treatment. So you had asked, how does somebody potentially know that they have this? And here's the kicker. A lot of people don't know. That's why it's so underdiagnosed, because if you live alone and you're not sharing your bed with someone else, but you're snoring and gasping all night long, you may just wake up feeling really unrefreshed, just wondering like, why the heck am I so tired during the daytime? But that snoring may not really wake you up, or like I said, those micro arousals are kind of brief enough that maybe you don't really remember them. They're enough to disrupt your sleep, but they're not really enough to wake you up every single time. So you may just wake up feeling really unrefreshed, that you've spent enough time in bed, you've got this daytime sleepiness, maybe you're having headaches in the morning. That's also a red flag, is if you're waking up with headaches. If you do share your bed with a partner, oftentimes they're the ones who will say, hey, we need to go to the doctor because you're snoring, you're gasping. I watched you lay there and not breathe for a whole minute last night. So it's oftentimes friends or family members that are the ones who they really prompt us to go and to get this diagnosis. when I talk about who has sleep apnea more, whenever we're talking about between men and women, men are 2 to 3 times more likely compared to women, but then after women go through menopause, then their rates look similar to men because of the changes. Yes, the changes in estrogen and progesterone change the way in which our airway continues to stay stable, because progesterone is kind of like a stimulator almost for the throat muscles. And so as we go through menopause and those hormones drop, then we tend to see much, much higher rates in women. And I want to point this out for any ladies out there who are listening, is that your obstructive sleep apnea may not look like this snoring and this gasping. In fact, it may look more like insomnia. It may look like irritability and just feeling tired, but it's not this huge red flag of the snoring. So I want people to also know that too. So I would say that those are like the major, major red flags. And then whenever it comes to obstructive sleep apnea, depending upon how many of those events that you have each night, a doctor will give you a category of mild, moderate, or severe. Whenever it comes to mild, there are lots of lifestyle things that we can do. So exercise. Not only is exercise great for us and great for sleep, but it's helping us restore lung capacity and kind of like really building up those muscles, especially if we're doing something like a little bit more of a vigorous exercise. One of the things that we often hear is weight loss, because whenever we have excess weight, we have a thicker neck, we have fat deposits around the neck, and fat that's kind of like in the abdomen, that's only pressure that's being put further on the lungs, on the airway. And so whenever we can lose weight, that's wonderful. Some other things that we can do, like I talked about, alcohol and sedatives and things that are going to be like muscle relaxers. If there's a way to cut those out or change the timing in which we use those, that's great. Smoking is obviously not great for you, but whenever it comes to obstructive sleep apnea, you're only stacking the deck against yourself because of how poor your lungs are going to be functioning if you're a chronic smoker, or the inflammation and the mucus, things like that. So there's a lot of issues there. Also, people who have allergies or some type of like nasal condition, those can make obstructive sleep apnea worse. So just kind of thinking about how we can treat it in almost like a wraparound fashion. You've probably heard of oral devices. So these can be custom fitted and made by a dentist. And this would be something that a sleep specialist would recommend based on how many events you're having per night. And what can happen with that, there's a couple of different oral options. One will kind of pull the lower jaw forward in order to keep the airway open at night. Another different one, kind of as gross as it sounds, suction cups to the tongue and keeps the tongue forward so it doesn't lapse back and close off the throat. Yeah, so we have some kind of really interesting devices.
Exactly. Never heard that one.
Yeah, that one's an option for folks. Normally, that's great for mild. Whenever we get into moderate or severe, then we're talking about a CPAP. And I think most people have probably heard about a CPAP machine. And this is something that I often did when I was at the VA, because especially when we get into military and first responders, you've probably had a mask on you before. And oftentimes that feels very claustrophobic. You may have even had some type of traumatic event happen with the mask on. And so this was something that I did with my veterans at the VA, was people have obstructive sleep apnea. The gold standard for treating it is a CPAP, and yet it feels so scary to have that on your face and to have it all night. And so what I would teach people how to do is some desensitization to it. So maybe we put it on, just the mask, we don't have any air blowing through it, and we put that on for like a minute, and that's it. It's like a baby step. Then we maybe put it on for 2 minutes. Then maybe we put it on and we read a chapter of a book. And we're doing this during the daytime, as we're just slowly building up our tolerance to wearing it. And then maybe we put it on the daytime and we turn the air on and we watch a TV show. And then we just slowly baby step towards our way of wearing it at night. And what you said to me is what I can't tell you how many people come up to me and say, once you get over that learning curve, how incredible having a CPAP machine is and how much it changes their life.
Yeah,
it is life-changing. You do kind of have to get over that learning curve. But one thing I want to mention that a lot of people don't realize, we have CPAP, and that is a continuous positive air pressure. That's what CPAP stands for. Continuous positive air pressure. For some people, that can feel like a lot. It can almost feel like drinking out of a water hose, for lack of a better analogy. And so it can feel like a lot, especially when you're trying to exhale. Now, there are the machines are getting better and better. Talk to your sleep tech because they can make adjustments. There are auto-adjusting machines as well. But something else that may be an option for folks is what's called BiPAP. And BiPAP has 2 different modes where like one mode is when you inhale, one mode is when you exhale. And it's just a little bit easier for people to exhale, especially because that's one reason why we see a lot of people who are just like, yeah, I can't use it. I'm not willing to use it. It's just way too hard for me to exhale. So those are options. And then if you get into severe, then we might be talking about surgery and some very more serious options. Now, one thing you didn't hear me say, mouth taping. Yeah. That is very, very trendy right now in the social media space.
Really?
Oh, good Lord.
They just tape their mouth shut.
Tape the mouth shut. And they're saying, oh, it's great for snoring, it's great, I'm not going to breathe through my mouth anymore. Hi, I'm a doctor and I specialize in sleep. Please don't do this. This has the potential to be very dangerous for some people, especially when we're talking about people who maybe have obstructive sleep apnea, maybe they have nasal issues, maybe they have throat issues, and they're already not breathing well, and they think, oh, well, this is going to solve the problem. No, actually, this can make things significantly worse. So please, please don't do this. If you're concerned about this, go talk to a doctor. That's what you actually need to do.
Yeah, 100%. And I'll tell you one thing, I couldn't figure out what was causing mine. Most of my adult life, I've typically been around 220, 225. And when it started, I was probably maybe 225, 230. Not that much more weight, but I saw that TRT was one of the causation factors. And I just started TRT probably like a year before. So, can you tell like the guys who are on TRT that maybe they could be more susceptible to it, if that is indeed correct?
Well, something else that I want to mention too is that I think we have such this perception of like, if you're overweight, then you definitely have obstructive sleep apnea, but genetics can play a part of it. Like the build of your jaw, the build of like your internal like mouth and throat, like musculature, like all those things can play a difference as you age. Like I said, your gender, like there are just some factors that we can't necessarily change. So like your genetics, your age, your gender, these things we really can't do a whole lot about. Yeah. But there are things that we can do something about. So you were mentioning, you said TRT?
Yes.
Tell me what TRT stands for, because I was going to say, I know a lot
testosterone replacement therapy.
And I'm kind of wondering what you're talking about.
Testosterone replacement therapy.
Sure. So whenever it comes to testosterone replacement therapy, this is a space where I don't feel like I can talk super knowledgeably about. However, one thing that I will say is when you are not sleeping well, testosterone is one of the many hormones that is produced at night during sleep. And it's kind of like the MVP of sleep. So if you're not sleeping well, your testosterone is going to be low. If your testosterone is low, there's going to be lots and lots of other factors that come along with it, like low libido, like having a hard time with muscles and recovery, all kinds of different things like that. So whenever we get to a place where we're sleeping better, our testosterone is going to go up. So I think that this is also kind of like that cyclical relationship of you might have low testosterone, you find out you have obstructive sleep apnea, we treat obstructive sleep apnea, then your testosterone levels go back up because you are getting this full night of deep sleep and it's just very restorative and your body's doing what it needs to do. So I hope that that answers your question there about the relationship between the two.
Yeah, absolutely. And could you just explain how severe potentially could be going untreated in terms of Alzheimer's, dementia, what diseases are associated with untreated sleep apnea?
Oh, absolutely. So whenever we talk about poor sleep, there's so many things that come along with that. But then when you put obstructive sleep apnea and untreated obstructive sleep apnea on top of it, you're just kind of adding fuel to the fire. So yes, you're exactly right. Like our cognitive functioning, our attention, our memory, our productivity, our focus, our decision making, all are at risk. But then, I'm glad that you mentioned this, is when we are not getting the sleep that we need at night, and when you are, so I think people maybe not take this seriously, so let me just kind of say it in another way. Let's say, for example, that you're someone who wakes up, but you spend 8 hours in bed, you wake up, you feel unrefreshed, and you don't know why. So let me just kind of paint a picture of what obstructive sleep apnea might look like. And I'm going to do this super mild. We're just going to say 10 events per hour. So think about you laying in your bed, let's just say from 10 to 11 p.m. I come in there and I wake you up 10 different times. And maybe it's not fully that you totally wake up and be like, what the hell? But I'm just kind of gently waking you up enough to cause some disruption.
Right.
Okay, then I come back in from 11 to 12. I wake you up 10 times throughout that hour, and I do that every single night for your whole entire night of sleep, yeah, just imagine how incredibly disruptive that is, how annoying that is. So when that's happening, our sleep is fragmented. We're not getting into these beautiful, important restorative stages of deep and REM sleep, and that's where we're getting into issues. So one of my very favorite pieces of information to give people is during deep sleep, your brain does something incredible, like off the charts incredible, where the brain shrinks up and it allows cerebral spinal fluid to come up and give your brain, I used to call it a brainwash, now I call it a car wash. But it gives your brain this wash, and it clears out all the junk and the gunk and the misfolded proteins and all the crap that's been building up all day, and it takes it out of the body and removes it as waste. Now, if we're not giving our body that very, very important chance to do that, it's building up. So think about it like, I don't know, you probably do this. I imagine everybody listening probably does this, is you put your trash out on the curb, and the waste management people, and they come and they take it away, and you never think anything more about it. But if you're going to continue to build up trash, and you keep putting it out there, but then the waste management people don't show up, and the trash builds and builds and builds, and maybe we start to get rodents, and maybe it starts to like really stink, and we're going to start to get some health hazards. That's what's happening in the brain. So imagine that all this junk and gunk is like gumming up the works in the brain, and the neurons can't communicate properly with each other. But when that happens, and I like to ask my audience, have you ever heard of the words tau or plaques or tangles or beta amyloids? And most people are shaking their head. And I say, what is that typically associated with? Yeah, it's associated with the neurodegenerative disorders like dementia, which is an umbrella term, like Alzheimer's disease, like Parkinson's. So whether you're getting poor sleep or you've got this poor sleep with obstructive sleep apnea that's untreated on top of it, yes, neurodegenerative disorders are a huge, huge risk factor. And I'm not saying that poor sleep will cause you to have Alzheimer's. I'm not saying that.
Right, of course.
But there are lifestyle factors, there are genetics, there are other things that come into play. However, if you're interested in having a long lifespan, but also a long health span, meaning that these years are good years and that you're in good health and you can enjoy yourself, yeah, you better take this freaking seriously.
Yeah.
Yeah.
Yeah. I was diagnosed myself with severe. I think they were telling me it was over 200 events per hour.
Yes.
And like you said before, I was getting 9 hours of sleep or in the bed for 9 hours, and I wake up exhausted. Mm-hmm. And I was like, what the heck is going on when it first started happening? And then my ex was telling me about the snoring. And it's funny because I only got tested because I'm like, it's not fair to be snoring in bed for her, because my dad was an insane snorer and my poor mom had to deal with that for years and years. I'm like, I can't put someone through this. And then went, and I was expecting to not have it. And the guy's like, yeah, you're severe. I was like, okay, glad I came and got tested. So guys, if you have it, don't avoid getting tested, man. Getting that machine is life-changing. I promise you, you'll regret not having it done years before or done it years before.
Yes, 100%. And so as you were learning to use your machine, did you have a learning curve, or was it good to go for you?
I would say, thankfully, I only needed the nasal cannula, number one, but I would say 2 days I was good to go. The first night's definitely awkward. The inhalations are easier, but the exhalations, because the air is blowing against you, it's a little more difficult, and you have to get used to it. But once you do, you don't even notice it after that second or third night.
And that's an excellent point that you make. So I had mentioned, and this is more of like old school, and it depends on what kind of sleeper you are, and your sleep tech will recommend what the best mask is. But there's nose and mouth, there's kind of like just a nose one, and then there's what we call like nasal pillows. So there's a few different options, and again, they're coming out with new and exciting things all the time. So if you're thinking, oh my God, I couldn't possibly wear something like that on my face, the options are getting better and better. So please, please go and get tested. Again, I think just like your story, there's so many people out there who don't know. They don't understand why. Why am I unrefreshed? What's the freaking deal? I've been in bed all night. Please go and get tested. It's worth asking about. And now there's lots of different ways to do at-home studies before having to go into a sleep clinic. Because I just had a conversation with someone the other day, and they're like, "Oh my God, I can't go to the hospital. I can't sleep overnight. I'm so anxious." And so people who have like more mild to severe cases, it can be diagnosed with just a home study. And now, again, that technology is getting more and more advanced as well. So it's not nearly what it used to be. And we're just getting so much better at detecting it. So I would say, please go and do yourself a favor. Even just go have a conversation with your doctor.
Yeah, absolutely. And one more question. How is that, is it Inspire? It's the brand name of the implant?
Yes.
How does that work?
Yeah, so the way in which it works, and not everyone is a candidate for it, but we'll talk about it, is that a small device is placed kind of like underneath the collarbone, and what it does is it like zaps the like a very particular nerve, and basically what it does is it kind of zaps the nerve to keep the tongue in such a way where it's not blocking the airway. So this is not an option for everyone, and it is a small surgical procedure. Normally, I would say that most insurance companies won't let you get to a device like Inspire without trying a CPAP first and giving it a real good shot. But there are some people who are candidates, and there are some people who that's a great option for. But normally, they'll have you try other options, especially CPAP first, because CPAP is our gold standard. It's tried and true. We know that it works. And oh my God, can it change your life?
100%. Could not advocate for it any more than I do.
Yeah.
So,
good. And we need to keep having these conversations.
Yeah, absolutely. You know, there's so many guys who really have no clue what's going on, number one. And then there are others that have somewhat of an idea and they're just so stubborn. So, you know, my thing is,
yeah,
you're only hurting yourself. And you could be hurting yourself greatly.
Oh, yes. I mean, especially if you are someone who's thinking like, I'm young, I'm fit. I just had a conversation with someone who wears one of those Whoop bands. And that data, I guess, goes directly to their doctor. And the doctor had been looking at the data and said, hey, I think you need to come in. I think that you have obstructive sleep apnea. So again, like tools that we already have are getting better and better, and it's incredible. And just that story was, I was so glad to hear it, because this person, you know, I wouldn't have necessarily tagged them for being obstructive sleep apnea either, because they were very young, they were very fit, they were, you know, had a very nice physique, and it wasn't, you know, what we stereotypically think of as like, oh my gosh, it's this big overweight person. No. And again, same for you ladies. Whenever it comes to obstructive sleep apnea, and especially after menopause, the rates go up significantly. So we need to get this stereotypical person out of our head and just think it could affect anybody. And actually, a lot of people don't know this. Kids can have obstructive sleep apnea too.
Really?
Yes.
I had no idea.
Yes. Kids
How young are you talking?
Yeah, oftentimes what will happen for the kids is that they'll take out their tonsils, and sometimes that will help fix things up. But yes, kids can too, so just a public service announcement there.
Yeah, absolutely. Would it be diagnosed the same way with kids, snoring problems, and then they're waking up exhausted every day?
That's a good question. I don't do pediatric sleep, but I would say that it's probably something similar along those lines, or like, you know, the kids not acting the way that they used to, they're not functioning well, maybe they're falling asleep in school. I would say that those are probably like red flags for kids. Yeah, but I imagine that it probably looks similar to adults, but with a child twist to it.
Right.
Yeah.
That's amazing. Poor kids. All right, I wanted to switch gears a little bit here.
Okay.
You know, my podcast is about helping these men and women who are still going through PTSD, various traumas. The suicide epidemic is just incredible in this country, between vets, first responders, and frankly, civilians, period.
Yeah.
It's a very broad question, but all right, let me phrase it like this. You have a family member who's going into law enforcement, going to become an FBI agent. What is your advice to them? How do you talk to them and explain some of the level of trauma that they're going to experience and how it's going to affect them and how they need to process it without getting these, you know, unbelievably detrimental effects way down the line? What's your advice? You know, you're speaking to your little cousin. Bam, he's going into the academy and he wants to have a serious talk about you because he sees all these guys suffering. How does he go about it to minimize the potential for him to suffer the same thing down the line?
Yeah, and I think that it's becoming aware. I think it's this almost like stress inoculation, if you will. And I think that we don't do the best job of being proactive. We're significantly more reactive. And that's not just the Bureau, that's across the board. We don't do a great job of letting people know. And so one of the things that I used to be very involved in with the Bureau, and more on the helping people who have gone through this or who have worked this, I used to do a lot of CSAM. So child victims, child sexual abuse material. And I think that what we really need to be doing is letting people know of, you may be working this violation, or you may be, even if it's not to that level, but letting people know what it is that they may encounter whenever they go into a job. Because, the example that you just gave me, you said, oh, this person's going to go join the FBI. Think about how freaking incredibly exciting this person is. Like they're having the time of their life. Like they're running and gunning. They are so excited. They are invincible. And that's wonderful, like to be so excited. And I'm sure lots of people feel that way when they join the military, when they become a cop, whatever it is.
Yeah, that was me.
Exactly. Absolutely. It's most people. But what we need to do is have realistic conversations about, that's a great way to burn yourself out, and to be careful, and to have this work-life balance, and to make sure that the job isn't fully your identity, and to have other things on the outside that are important to you, and not to neglect those things, because that's a road for burnout. But also, whenever we're so excited and we're running and gunning, we're volunteering for all these different types of things, which is great, and you're getting lots of different experience. But I think it's important too that we are willing to be self-aware, that we're willing to be self-reflective, that we're willing to listen to people. Because, say for example, you have a partner and you've been with them for a long time, and you were with them maybe before you joined the academy or whatever, and then they start to tell you like, hey, you're not yourself, or like things are changing, or something's off, words like that, and we're kind of like, whatever, like I'm not listening. Take that seriously, because that's one of the very first indicators of, I'm going down this road, and you can certainly turn around, but this person is trying to tell you, hey, you're starting to go down this road. And so when we're willing to be self-reflective, and I think that we often brush these things off, but if we're hearing it from friends, from family members, from coworkers, it's really important that we listen and to notice these changes in ourselves. And I would say whenever it comes to this very machismo culture of toughing it out and pushing through and one more call and you just keep going, we need to kind of take a step back from that and just be a little bit more sensitive about, what is it that I'm seeing? What is it that I'm going through? And something that you mentioned earlier is, I am being a part, time after time after time, of the worst possible thing that this person has probably ever gone through, and they probably will have ever gone through. And like, just taking in the gravity and the magnitude of that. And instead of brushing it off, kind of sitting with it and processing it, whether that looks like journaling, whether that looks like meditation, whether that looks like peer support, chaplain, therapy. There's lots of different ways, but we can't just continue to brush it off and push it to the side. And I have so many people who are like, I'm great at compartmentalizing, and I'm like, but you're also in my office, so...
Exactly.
There comes a time where you can only compartmentalize, and I'm doing this in air quotes for anyone who's just listening. You can only do that so much until you run out of space. And then, we hear that phrase of, you have to put your oxygen mask on first before helping others. When you don't do that, then you're starting to be really ineffective. And so we have to take good care of ourselves. And there's a lot of different ways that might look. But I would say first and foremost is just letting people know what it is that they're stepping into. And maybe that looks like talking to people who have been veterans and who have done this for a long time and who are very seasoned and can tell people. But I would say that's where we need to start, is at the very beginning, like on the first few days of basic training or academy or whatever, of these are things that you will be exposed to. It is normal to have feelings about it and to be upset about it and to feel this on the inside, because it would be unusual if you didn't. And here's the thing, when it comes to military, first responders, special agents, whatever, we ask you to see and to do a lot of things that are not normal, that your average librarian or banker would never come across even once in their life, let alone how many times in one single day that you do. And so just kind of grasping the magnitude, because when you are in that culture and all your friends are also in that culture, you don't understand how far you have been removed from normal from baseline. And so I think that there's a couple different ways that we can go about doing that, but I think that very much it's kind of starting from the beginning and telling people what are some of these red flags and things they need to be paying attention to, and to feel your feelings.
Yeah, it's true. I mean, you have to become vulnerable. Trust me, I couldn't do it. I wasn't able to do it, I should say, up until the last year and a half when I journeyed with ayahuasca, and it changed my life, and I was able to become vulnerable, and that's when I was able to start healing myself. And if you don't, and you keep up that machismo act, you're not going to be honest with yourself. You can't be honest with anyone else. When you look in the mirror, I mean, most of us lie to ourselves. Like, how are you expected to be able to speak to someone else if you can't be honest with yourself and feel? It's actually a sign of strength to feel that emotion. Right. You had mentioned family members being the first ones to see these changes in us. Mm-hmm. I kind of came up with a method. Let me know your thoughts on this, please. Mm-hmm. We have this habit of not bringing things home. We don't want to bring it home to our families. So we shut down, essentially, and we shut them out. And now they have no context in which to put our behavior. They just think that, Mike's nuts, man. He comes home, he's got this bad attitude, blah, 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 blah. When in fact, if they were to know what you experienced that day, it would make perfect sense as to why you're acting and feeling the way you are.
Yeah.
So my method to tell, like, active duty guys and girls is have a talk with your spouse today. Nothing's going on. And you come up with a method where I come home, say I'm working, I used to work 3 to 11s. So I come home at the end of the night if she's still awake, and the first half hour is mine. No one come to me with anything. Just let me unpack my stuff. Let me just kind of release the day's activities. After that half hour, bam, Dad, Mike, back in the game. Come to me, whatever you guys need. If that day I experience something very traumatic, I come home and all I have to say is, baby, today was really tough. I need tonight. The night is mine. Before I go to work the next day, we have to sit down and talk about what I just went through. Now, I can paint it with broad strokes. I don't have to give you every single, detail about what happened, especially if it's horrific. But just to give you a sense of what I just experienced, and, the fact that I'm still processing it, and the fact that I may withdraw a little bit, which obviously is the worst thing we could do. But, we have bad habits of isolating and withdrawing. But, just to be able to put our behavior in context, and now your spouse is feeling a part of your work life in certain respects. Again, you don't have to bring every detail home. Just paint it in broad strokes so you know what's going on. What do you think about that policy, so to speak?
Yeah, I think that what you're describing is something that we often give advice about, because a lot of people kind of get wrapped around the axle of like, well, I can't share anything about my work. And what we'll say instead is, but you can share how you're feeling. You can share your emotions. You can share what's going on inside of you. And so, yes, normally people will use their commute, depending upon how long that is, or they may, when they first get home, they'll go and walk the dog for a good 30 minutes. So they're getting something done, but they're also having that like process time too. Yep. So that's often something that we recommend. And then, as you mentioned, kind of like a code word of like, whatever that word is, your partner knows like, okay, back off. We don't touch this. So yeah, those are definitely recommendations that we give to people. Absolutely. Yeah. Yeah, it's challenging. It's a double-edged sword because we certainly don't want to traumatize them, but whenever we share our feelings and what's going on with us, then we can kind of find that middle ground of we're not totally locking everything away, we're not spilling our guts and traumatizing them, but we're finding this middle ground of you can at least understand a little bit of what's happening for me.
Yeah. They feel like they're in the fold, and so they're getting bits and pieces, but they can again put your behavior into context and then realize why you're doing and saying some of the things you were saying and doing. And that's not to justify if you're treating someone like garbage. I'm not justifying that behavior, guys and girls. So don't go home and be talking smack and be like, yeah, I was listening to this podcast and the guy said this. No. Don't justify that. There's no justification for treating your family like garbage, but kind of bring them in the fold and explain a little more. I had sent you a video. I'm not sure if you got to see it, and I'm curious as to what you would do in the situation if a officer or an agent had come to help you about this. So the video it looked like a car stop. I don't know if it started out that way. These guys got a call, and it was an obvious EDP. She's just talking around in circles, and she's mentioning her kids that are lost. And lo and behold, at the end of the call, her 2 dead kids are in one of her suitcases or 2 of her suitcases. So as this is unfolding real time, you're looking at a body cam. These guys are real. One of the guys is like, he cursed. He's like, don't tell me there's a kid in that bag. And boom, he peels it back and he reels back. Another guy, you can hear he's crying. Like it was a heavy, heavy call. How do you speak to, guys and girls come to you for something like that? What's the conversation like between you and they?
It's interesting that you say, what's the conversation like? Because sometimes there are no words. Sometimes we just sit in kind of a supportive silence, and maybe it's crying. Maybe it's staring off into space. And that's okay too. That's also a form of processing. But I also meet the person where they are. And sometimes people are just not ready to talk. And I let them know, hey, I'm here. My door's always open. And just allowing them to come when they're ready, to talk when they're ready. Because I think that there's also like an element of being forced to talk then might make things even worse too. But I would say just being a supportive presence, or maybe just starting with a very open-ended, what was that like for you? So I don't have any magic words, because there's going to be shit like that happens day after day after day, multiple times a day, that y'all will see. And so it's more of being this supportive presence and having this safe space to unpack things, if that's a time and a place that you're ready. Because sometimes we kind of just need to sit with it ourselves until we're ready to go there and to bring another person into that. So just not pushing it and being open and letting people know that I'm there, that's how I would approach that.
Okay, and in that same situation, say you're talking to a man or woman, is there something that they may say or do at that point that would lead you to suspect this is a lot more serious, in terms of maybe they need immediate help, like this has really affected them, and I don't want to just kind of let them walk out the door? Like, can you kind of explain like what you might see or feel from them?
Yeah, so if I'm seeing that person very soon after they're experiencing that, they're gonna have a range of emotions, because again, that is not something normal. We are exposing you to a very abnormal situation, and the reaction that you're probably having, whether it's silence, whether it's crying, whether it's being angry and swearing, those are all going to be normal reactions. I'm not concerned unless we're getting into a situation where you tell me the only way that I'm going to be able to forget this is if I go home and drink X alcohol, something along those lines where I need to go black out. That is concerning to me. Or we're talking some type of hints, signs, or even outright telling me that they're having thoughts of suicide. Those would be things that I would be worried about. So some type of drug or alcohol, substance use, and some type of hinting at, or just being outright talking about suicide, those would be the things that I'm concerned about. But one of the things we need to talk about and normalize is when you experience something, and I'm a psychologist, the DSM, the Diagnostic Statistical Manual of Mental Disorders, is what we live by and what we use. And you'll notice, if you read it like we do, that you cannot give a diagnosis up until at least 3 days after a traumatic event. And the reason for that is you will go through a range of emotions. You probably won't be able to get it out of your head. It's probably going to infect your sleep and your dreams and your nightmares. And for those first 3 days, that's really normal. And then after that, it's still pretty normal, but we could then potentially get into a diagnosis of adjustment disorder or get into a diagnosis of post-traumatic stress disorder. But here's the kicker, right? Like, think about all the people, and we're also talking civilians too, like tons and tons of traumatic things, whether it's car accident, rape, robbery, all kinds of very traumatic things happen to people on the regular. And yet, the amount of people who are traumatized and the rate at which we diagnose PTSD, they are not equal. The amount of people who experience things that are very traumatic is huge. It's off the freaking charts. But the amount of people who actually then get diagnosed with post-traumatic stress disorder is comparatively extremely low. And that's because we are very resilient. We do bounce back. It will take time, but we do bounce back. And then there are some people who it continues to stick with them and they do need more help and assistance. But it's really important for us to remember that. And so, yeah, if you're coming off a call like what you just described and you're seeing something really horrific and it's children, there's an extra element when it comes to kids and something familial that's happening. Yeah, if you want to go to, if you feel like punching a hole through a wall, I'm not concerned about you. Most people probably would feel that way because this is something really sick that happened and you're being exposed to this.
And in that case, where you said they were referring to possibly going and having it down a bottle, what do you do at that point, or what do you say at that point? And this is for people that, whose friends or family member come home and this is the way they're feeling after they just saw something. What would you tell them, or how would you handle it yourself so they kind of have something to work off of here.
Yeah, if that was something that was said to me about, I'm going to go down a bottle and that's how I'm going to deal with this, what I would ask is, what other tools do you have in your toolkit? What else could we possibly do? And sometimes people can think of things and sometimes they struggle. But what I really want to know is, what other options do you have? Because whenever it comes to alcohol, and this is a whole nother rabbit hole that we can go down, it's not good for your body. It's terrible for your sleep. If you're not sleeping well, one of the many functions that happens during sleep, and we could do a whole episode on this, is we process painful life events and trauma. And so when we're not sleeping, then the brain isn't able to process that trauma. So the next day, we're not getting that emotional detox that we should have because of the alcohol. So instead, can you go to the gym and go to do an insanely hard workout and just kind of wear yourself out that way? Can you go for a walk by yourself or with a dog and just go cry? Can you journal? Like, I know that these might be like touchy-feely things, but like, what else can you do to kind of try and get these emotions out? What else can you do? What other tools do you have in your toolkit besides turning to the bottle?
Yeah, it's great advice. One thing that I never realized in my career until afterwards, and now getting into the space, is I never realized how many first responders and military vets have had, I don't know if I want to say adverse childhood experiences, but maybe traumatic childhoods, and very many of us have had poor relationships with our fathers growing up. Mm-hmm. Because I tell people, like, I don't care how fierce you are, how old you are, if you experienced that and you didn't get what you thought you needed during your formative years, you're still hurt. You still have that hole. How important is it, and how do guys, in their 50s, coming off these careers, who are still experiencing that trauma, how do they heal from that? What can they do?
Yeah, this is a very big question. So whenever you talk about childhood trauma, like, when we are a child, we're figuring out, like, what is this world? What does this look like? What does this mean for me? Is this how I deserve to be treated? Is this what everyone else is going through? Like, this is a learning experience for you to figure out what the rest of your life is going to look like. But it also kind of creates this template for relationships in the future. So if I see my parents having this knockdown, drag out fight several times a week, well, I assume everyone else's house must look like this, and this is what we must do, and I can't wait to get my own girlfriend so I can do this too. This is just like, as you're growing up, this is what you learn. Your brain is trying to absorb information and make connections and figuring out what it's supposed to do. And like, whether it's relationship with parents, the relationship between the parents, there's a lot of different dynamics that come into this, and that's one of the main factors of how it will create what we call an attachment style. And again, this could be a whole podcast in and of itself. But yes, if we are having these traumatic relationships or abusive relationships or neglectful relationships or, you name it, that will set the stage for what our future relationships will look like and what we assume we deserve from the world or what we are going to put into the world. And so I would say that there's a lot of traumatic things that happen to us whenever we oftentimes use the ACEs, and that's exactly what you're talking about, is the adverse childhood experiences. You can go find this study, the survey online very easily. It's very short and sweet, and you can rate yourself on experiences that happened to you before the age of 18. And some of them are relatively mild, like, oh, my parents got divorced, but then some of them are, my parent was incarcerated, or, it ramps up, and it'll give you a score. And the higher the ACE score, the higher the trauma. And also, it has a lot to do with how the rest of our life plays out and health behaviors and all kinds of things. So our formative years really play a very big role in this. And I would say the higher your ACE score, I'm sorry to say, probably the harder you're going to have to work at coping skills, at potentially therapy, at working hard to cultivate a healthy relationship with other people. And I think just in the most generic sense is, yes, you have to work hard to get to a place where you are breaking that pattern and you're cultivating this life for yourself that is healthy.
Yeah, it's, I don't know. Like I said, I never realized the extent of the amount of guys that have had, I haven't spoken to too many females about it. I mean, you guys are so much better in processing emotions anyway. But it's funny. It's a double-edged sword because we go through these experiences, And in some respects, it teaches us how to callous up and deal with that pain, essentially with just burying it. And then you go into these hyper-masculinized professions, and it serves you well in that respect in many ways. But at the same time, the chicken's going to come home to roost one day, and that lid is going to blow because everyone's got a saturation point. It's different for different people, but everyone's got that point. And if you're not processing these things ever, man, it's going to blow, and it's not going to be pretty when it finally does.
Right, and maybe that looks like a lot of different things too. It could come out sideways. It could come out in a lot of different ways, and that's also what we were talking about earlier too, as far as like maybe that comes out and that's what your sleep issues are, and you can't put two and two together. But
really?
Yeah, like maybe you've had these very traumatic experiences as a child, and maybe there was something like a case that you're working on, or something like a traffic stop, or something that like just kind of gave you this like almost like undercurrent of like, oh, that hit home. Then that's absolutely something that can impact your sleep too, of like, oh, whoa, like something, I like to call it, my snow globe got shook up. And I think that, and absolutely, like those things stick with us. And so it could come out of left field. You never see it coming, and that something can shake up your snow globe, and that can absolutely contribute to sleep problems too. And that there is hard to put your finger on. You're like, what the hell? Why am I not sleeping? What's going on? So it's so dynamic, all of it. When it comes to mental health, psychology, sleep, trauma, it is so incredibly dynamic and hard to untangle. And I don't know that we can ever fully untangle it, if you will.
Yeah, the mind is it's the strongest muscle in the body. It's amazing though. The voices in your head are always so loud when you're talking about negative things. But, and you're talking down to yourself, and, you start speaking positively, and it's almost like a whisper. But it's amazing. Like that same negative mindset that got you down here can be used positively and ascend you to heights that you never thought possible. But it is amazing that it's so easy to go to the negative.
Right.
And it's so difficult for us. And it's so easy to talk negatively to yourself. And I've stopped doing that over the past year and a half. Like I stopped that immediately. I was talking to my wife about it one day, and she's like, you talk to yourself more than anyone in your life is ever going to speak to yourself. Mm-hmm. Why are you talking to yourself negative? Because I do something like stupid ass. She's like, why are you saying that? And it's so true. Just in changing that one thing, the way you talk to yourself dictates mindset in many respects.
Right. And earlier when I said you have to work harder, those people who had more of a mainstream, we'll call normal childhood, their thoughts, are probably more balanced. They probably have some thoughts like, oh, you really effed that up. But also like, hey, nice work today on that presentation. Whereas the people who had negative messages coming to them from family members, then you learned, oh, well, I must be an idiot. I must be a dumbass. This is who I am. And I must continue to talk to myself this way. So you have to work that much harder to kind of like claw out of this hole of this negative thinking.
Yeah, it's so true. And it literally changes your whole perspective, I think, on life. And, I try to live my life from a point of gratitude, literally thanking God, the universe, for everything I have, not kind of concentrating on what I don't have. And even bad experiences. Like I had a talk with a mentor about a year ago, and he's like, thank you, universe, for every single thing it puts you through. It could be the most visceral pain in the world. There's a lesson to be learned. You may not know it right then. It may take you years. Like, for instance, that 2-year-old that I referenced, I realized 5 years later that the universe wanted me at that house. I was supposed to be there. I was supposed to handle that call, because had I not, number one, I wouldn't have realized what I was going through. Number two, I'm doing what I'm doing now to help others, and I already know it saved lives. Mm-hmm. So I was there at that most heartbreaking thing for a purpose. And, that's the way you have to look at things, no matter what you're going through. Don't duck it, because... I love Rocky's speech in Rocky Balboa. He has a speech to his kid about nothing hitting harder than life. You can't duck it. Be like the buffalo going into the storm instead of trying to run away from it, because you can't duck it. I don't care how good looking you are, how rich you are, how tough you are. Life is going to knock you down to your knees, and it's what you do next. You know what I mean? Take that step. Just start putting one foot in front of the other. You know better than me. You speaking to people every day about these traumas that they're going through. Like, how important is that to mindset? How important is mindset in life?
Oh, 100%. Yeah, you cannot downplay the importance of mindset and how that sets you up for how you're going to go through life. Yeah, you cannot downplay the importance of that.
Yeah, well said. I mean, it's so simple, yet it's so hard for many of us to do.
It's very hard. And it you know, I like to talk about it as like building a muscle. Like if you go to the gym, you do a bunch of reps, you may not see any improvement. But going back and doing it time after time after time after time, then that muscle starts to grow and you can start to see it and you can feel the strength. It takes time. And whenever it comes to, say, for example, hearing these things maybe your whole entire childhood, well, that's about 18 years worth of wiring that you're going to have to undo. And the brain can do it. The brain is super plastic for the most part. And it can be done, but it will take time, just like what we talked about earlier. If you've been going through this for weeks, months, years, decades, okay, we're not going to undo this overnight. The same thing with that negative mindset and the negative thinking. So it takes time, and just giving yourself the grace and the compassion.
Yeah, give yourself grace. That's great advice, because most of us don't do it.
No, we don't.
And yeah, we'll give it to everyone else but ourselves. It's incredible. Yeah,
yes,
incredible. I don't know why, but human nature, I guess.
Yeah. And we need to work against it, and we need to have more conversations like this and encourage people and teach them how to.
Yeah, exactly. All right, Doc, it's been fantastic speaking to you. Do you have any subjects you want to talk about, or any upcoming things that you're doing, or, floor is yours.
Thanks. So I'm going to mention my book, If Sleep Were a Drug. It's coming out on October 1st, 2025. And if you want to connect with me, you can find me anywhere. My name is Dr. Leah Kaylor. That's my website. That's my LinkedIn. That's my social media. And that's how you can connect with me.
And all the Doc's links will be in the bio. Guys, I hope you liked the episode. If you do, please hit like and subscribe. Doc, it's been an honor and a pleasure speaking to you. Thank you so much. I learned a lot myself, and I know everyone watching did as well. So, fantastic job. Thank you.
Thank you.
All right. Guys, take care.